Capgras delusion. Imagine looking at your mother and being absolutely sure that's not her. It looks like her, sounds like her, but deep down you know she's an imposter. This is Capgras delusion, a disorder where a person believes that someone close to them has been replaced by an identical-looking double. It's not just suspicion, it's an unshakable belief. Sometimes it's accompanied by fear, paranoia, or even aggression. One theory suggests it's caused by a disconnect between visual recognition and emotional response. The person sees a familiar face but feels nothing, so their brain concludes this must be a fake.
Frigoli delusion. The opposite of Capgras is the Frigoli delusion, the belief that many different people are actually one single person in disguise. For example, someone might think that the cashier, the neighbor, and the stranger on the bus are all the same person, constantly changing their appearance to follow or manipulate them. This condition is rare but dangerous, often tied to paranoid schizophrenia. People experiencing it can become agitated or even violent, believing they're being targeted. Cotard's delusion, or walking corpse syndrome. Some people believe they are dead, literally. They might say they have no blood, no organs, or that their body is rotting. They stop eating, bathing, or even speaking. After all, the dead don't need those things. Cotard's delusion is usually linked to severe depression or psychosis. In extreme cases, patients ask to be buried or taken to the morgue. Treatment often requires antipsychotic medication or even electroconvulsive therapy. Alice in Wonderland syndrome. Your hands feel tiny, your feet enormous. The room stretches and shrinks, sounds become distant or distorted. This is Alice in Wonderland syndrome, a perceptual disorder where people experience size distortions in their body and surroundings. It often occurs in children and teenagers and can be triggered by migraines, epilepsy, or infections. During an episode, reality bends and warps like a dream. For some, it's fascinating. For others, deeply unsettling. Tourette's syndrome. Involuntary movements, sudden sounds or words, sometimes even profanity. But Tourette's syndrome isn't a joke. It's a neurological disorder that begins in childhood and can be severely disruptive. Tics are not random. They come with intense buildup, like pressure under the skin, and performing the tic is the only way to relieve it. Many people with Tourette's learn to manage it, but others face stigma and misunderstanding their whole lives. Ekbom syndrome, or delusional parasitosis. A person becomes convinced that insects or parasites are crawling under their skin. They feel itching, stinging, movement, and scratch themselves raw trying to get them out. But there are no parasites. The symptoms are real, but the cause is psychological. Patients often bring in samples, lint, scabs, dust, as proof of infestation. They seek help from dermatologists, but the real solution lies in psychiatric care. This disorder is agonizing and extremely difficult to treat. Anosognosis. Imagine suffering a stroke, losing control of a limb, but being completely unaware anything's wrong. This is anosognosis, a condition where a person can't recognize their own illness or disability. It's not denial, it's a disconnect in the brain. The patient might say, "I'm fine," even when they can't stand or move. This lack of awareness makes treatment nearly impossible and is often seen in schizophrenia, bipolar disorder, and dementia. Erotomania, or Declarambault syndrome. A woman becomes convinced that a famous actor is in love with her. She sees secret messages in his clothes, his posts, his glances on TV. This is erotomania, a delusional belief that someone, usually of higher social status, is in love with you. The danger increases when the object of the delusion is someone close, a teacher, a boss, a neighbor. The obsession can lead to stalking, threats, and legal action, all while the person believes the love is mutual but hidden. Paris syndrome. It starts with a dream. Paris, the city of romance, elegance, beauty. But when tourists arrive, they're met with rude waiters, noisy streets, theft, and culture shock. Some, especially Japanese visitors, experience acute psychological breakdowns, anxiety, hallucinations, depression. The disappointment hits so hard it turns into a full-blown psychiatric crisis. Paris syndrome is rare, but a striking example of how powerful expectations can shatter the mind. Munchausen syndrome and Munchausen by proxy. A person fakes illness repeatedly. They seek attention, sympathy, care. They might inject themselves with bacteria or manipulate test results just to be hospitalized. Munchausen syndrome is an extreme form of factitious disorder where the need to be seen as the patient becomes compulsive. Even worse is Munchausen by proxy, when someone, often a parent, induces illness in a child to gain sympathy as a caregiver. This isn't just a mental illness, it's a form of abuse, and in the worst cases, it can lead to death. These individuals often fool doctors for years before being caught.